For decades, when we talked about the digestive tract, we tended to treat it like it was just this advanced plumbing system. A sophisticated pipe where food goes in, waste comes out.
Yeah, sort of a simple tube concept.
Exactly. But if you're dealing with any kind of chronic symptom, maybe joint pain or that weird brain fog, persistent constipation, you probably feel intuitively that picture's just way too simple.
It really is. And I mean, the sheer scale of chronic digestive and inflammatory issues people face today proves that old simple tube idea is, well, it's just wrong.
Mm-hmm.
The sources we looked at really confirm that if you want to resolve these often debilitating symptoms, you absolutely have to understand 5 key root causes of inflammation.
And that's exactly our mission for this deep dive. We're digging into those sources to uncover the 5 major drivers of digestive inflammation.
And crucially, give you the actionable solutions that the research points towards.
Right.
So maybe to frame this, let's start with a fact that's actually kind of mind-blowing. It explains why the gut is so central to, well, everything. 3/4. 75% of your entire immune system is distributed throughout your digestive system.
Wow, 3/4.
Yeah. Only 1/4 is found anywhere else in your body. So when you realize the gut is fundamentally an immune organ, the whole picture just shifts, doesn't it?
It really does.
Yeah.
And the defense line for this huge immune presence,
Yeah.
it's incredibly fragile, isn't it?
That's the second point. Think about this.
Okay.
The membrane separating the food and microbes inside your gut, which is technically outside your body, from the inside, your bloodstream, it's only one single cell thick.
One cell, that's it.
That's it. That single cell barrier is basically your firewall.
Okay.
And if it breaks down even a tiny bit, your body immediately sees foreign particles getting into the bloodstream.
And reacts.
Massively.
That's, yeah.
Triggers a huge systemic immune response that causes inflammation and often leads to new allergies or sensitivities to foods you used to handle perfectly fine. Honestly, the deepest insight from these sources is that maybe 75% of your chronic symptoms, insomnia, joint pain, you name it, might actually be a primary immune reaction, starting right there in that one cell thick barrier.
That's huge. And it brings us straight to the gut-brain axis, right? The whole second brain idea.
Exactly. Our enteric nervous system, running all through the gut lining, it actually contains more neurons than your central brain.
More than the brain in your head.
Yep. And these two massive networks, they talk constantly. They're connected via the vagus nerve, sometimes called the pneumogastric nerve. It's this two-way highway that makes the gut so incredibly powerful.
And we know that connection goes both ways, don't we? We've all felt it. That classic anxiety reaction,
Yeah.
the butterflies or that deep stomach upset right before a big meeting or an exam. That's your brain sending distress signals down to your gut.
Absolutely. But the sources also highlight the really fascinating flow the other way from the gut to the brain. They point out that some medications, like certain antidepressants, for instance, can actually cause digestive issues or mess with your gut flora first.
Right.
And then, kind of paradoxically, that gut disturbance can actually contribute to mood disorders like depression.
Wow. So the gut problem can actually worsen the mood problem.
Precisely. It confirms that chronic digestive inflammation or even food intolerances can directly change your behavior, your focus, your cognitive capacity. Your gut health isn't just, related to your brain health. Often, it pretty much dictates it.
Okay, so let's unpack the first of these 5 big causes of inflammation from the sources. This one seems to trip up a lot of people who are already trying to eat clean.
Yeah, FODMB sensitivity.
FODMAP sensitivity.
This is a really common stumbling block. You see people eating really well, avoiding processed stuff, gluten, common cereals, but they still have persistent digestive issues.
Right.
And the culprit is often these specific carbohydrates, known as FODMAPs.
Okay, I know the acronym's a bit of a beast. Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. But, in simple terms, what are they?
They're basically common short-chain sugars and fibers, found in lots of healthy foods, actually. Things like apples, beans, wheat, garlic, onions, some dairy products. A lot of everyday foods.
So wait, these are healthy, natural things. Why are they causing problems?
Because they're highly fermentable. When these substances get down into your large intestine, or sometimes even the small intestine where they shouldn't be in large numbers, bacteria have a field day. They feast on them.
Well,
and that fermentation process creates a lot of gas.
Yeah.
That leads to inflammation, discomfort, bloating.
Yeah.
And symptoms that go beyond the gut, too, like maybe increased joint pain or feeling like your thinking is fuzzy, worse cognitive capacity.
So it sounds like a balance thing. Our gut bacteria need these kinds of fibers, these high residue things, but too much just creates chaos.
That's exactly it. If your system is already a bit compromised, too much fiber, or specifically too many of these FODME sugars, leads to an overreaction.
Like bloating, cramping.
Yeah, and those non-digestive symptoms too, fatigue, even depression can be linked.
Okay, so what's the fix? The sources mentioned a kind of money-saving first step.
Yes. The initial approach recommended is simply eliminating the foods most strongly associated with FODMAs for a short time, say maybe a week, and just carefully track your symptoms, see what changes.
And this isn't necessarily forever.
No, definitely not. The goal is actually to improve your gut flora, maybe using probiotics, so that later on, when you reintroduce small amounts of those FODMA foods, you can actually tolerate them better.
Okay.
The sources also mention some specific plant-based remedies that can offer more immediate relief. Things that work by relaxing the small intestine and helping prevent some of that gas production, particularly methane.
Wait, you mentioned cabracho in the notes. Most people won't know that. Why these specific natural things, and are they easy to get hold of?
That's a fair question.
Hmm.
We're talking about targeted compounds, things like mint, which people know, or horse chestnut, that's the Castaño de la India reference, or, yes, cabracho extract.
Okay.
They work quite specifically to reduce spasms and inflammation in the intestinal wall. So they provide symptom relief while you're working on the root cause, which is often about getting the bacterial population back in balance.
And you can find these.
Yeah, they're generally available in supplement or extract forms from health food stores or online.
Okay. Let's shift to cause number 2, a lack of digestive enzymes. This sounds really common, often overlooked.
It is. And the sources highlighted 2 scenarios where it's particularly high risk.
Right.
First, people who suddenly eat a huge amount of food at once. Think about extreme intermittent fasting, or maybe OMAD, the 1 meal a day approach.
Right, you're dumping a whole day's worth of calories in at one sitting.
Exactly. Your body just has to have enough enzymes ready to handle that massive concentrated load.
Makes sense. What's the second group?
People who eat while they're under intense stress, whether that's work stress, family stuff, or even eating right after really intense physical training. Stress hormones drastically decrease your body's own production of these crucial digestive enzymes.
So trying to cram down 3,000 calories in an hour or eating lunch while firing off a high-stakes email?
Yeah.
Basically setting yourself up for digestive trouble.
Pretty much.
How can you tell if this is your issue, maybe without needing expensive tests right away?
Well, sometimes you can check the plumbing, so to speak, if you're eating a high-protein diet, but a standard blood test shows surprisingly low protein levels.
You're not absorbing it.
Exactly. That's a big clue right there. Fecal analysis can confirm enzyme issues, and often those tests check your flora and look for fungi at the same time.
But what about practical signs, things you might notice yourself maybe in the bathroom?
Oh yeah, the visual symptoms are key. Things like immediate bloating or gas right after you eat, feeling full really quickly. And crucially, actually seeing undigested food in your stool. Bits of fiber, maybe black or white spots.
Right.
And probably the most telling sign, especially for poor fat digestion, which needs both enzymes and bile, is stool that consistently floats.
Floats. Got it. Okay, practical solutions then. If stress is a big trigger, how do you manage the timing?
Rule number 1, try to avoid eating during your peak stress moments. If you can, maybe use fasting or intermittent fasting during those really high-pressure windows.
And if you have to eat?
Then use relaxation techniques first. Simple breathing exercises just for 5 minutes before you take a single bite. That helps switch you into the parasympathetic state.
It's rest and digest state.
Exactly. Which literally signals your stomach to release the enzymes and acid it needs.
Okay, the sources also mention supplements like tryptophan or 5-HTP to help relax the system. But let's talk about that acid thing. You said relaxation increases stomach acid. Isn't acid bad? Aren't we always trying to reduce acid for things like gastritis or reflux?
That's such a crucial point and a common misconception. While yes, reflux feels awful, having insufficient stomach acid is actually a widespread problem that seriously hinders digestion. Yes, being relaxed increases stomach acid production to healthy levels. And those higher, healthier acid levels are actually good for proper digestion and absorbing nutrients.
How so?
It signals the body to properly break down proteins. It helps kill off ingested bacteria, preventing overgrowth further down. And it's essential for absorbing minerals like iron and calcium. The issue with reflux is usually acid being in the wrong place. the esophagus, not necessarily that there's too much acid overall in the stomach.
Interesting. Okay, so if behavioral changes aren't quite enough.
Then digestive enzyme supplements can be used. But think of them as temporary support, like crutches, as the research puts it. The main goal should always be fixing the underlying reason why you're not producing enough yourself, usually stress or eating habits.
Got it. Temporary help, not a permanent fix.
And one last point on food prep. If digestion is really tough, processing the food can help. Think of green juice versus a pile of whole raw vegetables. Your body has a much easier time with the juice because the plant cell walls are already broken down.
Good tip. And we absolutely have to mention the special case. People who've had their gallbladder removed. Cholecystectomy.
Yes, this is really non-negotiable for those listeners. If your gallbladder is gone, your ability to store, concentrate, and release bile is significantly reduced.
And bile is key for fats.
Essential. It emulsifies fats, breaks them down. Without that concentrated burst from the gallbladder, digesting high-fat meals becomes much, much harder.
So I know the ketogenic diet is super popular. Why would that high fat load be particularly risky for someone without a gallbladder?
Because the body simply can't deliver that large, concentrated dose of bile needed to properly break down a very high-fat meal all at once.
What happens then?
The undigested fat travels down the digestive tract, causing inflammation, often diarrhea, and you don't absorb the nutrients properly either. The sources are very clear. They strongly caution against individuals without a gallbladder jumping onto a keto diet because of that heavy, hard-to-process fat load.
Okay, really important distinction. Now, cause number 3 takes us right back to the gut microbiome, bacterial imbalance, flora.
Yep. And inflammation can happen on both ends of the spectrum here, either having too few beneficial bacteria, that's dysbiosis, or having an excess of bacteria, often in the wrong place, like SIBO or colon overgrowth.
Let's start with too few. Dysbiosis. What causes that?
Usually it's a result of a long-term diet that's low in fiber and maybe high in sugar, or, pretty obviously, if you've had rounds of antibiotics that wipe things out.
What are the symptoms? Are they obvious?
Actually, they can be surprisingly subtle. You might have low gas production, which sounds good, but it can actually mask the underlying problem. Other signs can be chronic constipation, maybe an increase in allergic-type symptoms, and even things like decreased physical performance because your nutrient metabolism isn't optimal. Some sources even linked it to a tendency towards thrombosis or blood issues.
Okay, and the fix for too few bacteria?
Probiotics are key. The sources recommend broad-spectrum ones, meaning products with lots of different strains, or even rotating the probiotic products you use every couple of months to keep that diversity up.
But probiotics need food too, right?
Absolutely essential. You need prebiotics. That's the food for your good bacteria. Inulin powder is a great example of the sources mentioned. It's an effective prebiotic fiber, and you can even use it to naturally sweeten drinks slightly.
What about fermented foods?
Excellent source, too. Things like kefir, sauerkraut, kimchi. But there's a caveat. Only if they don't cause bloating or distension. If they do, it might point back to a potential FODMA issue or even an overgrowth issue.
Okay, which brings us to the flip side. Excess bacteria. SIBO, small intestinal bacterial overgrowth, or overgrowth in the colon. This is bacteria booming where they shouldn't be, or just too many of them.
Right. This kind of overgrowth is often fueled by chronically high carbohydrate consumption. Simple sugars are like rocket fuel for many unwanted bacteria.
What else?
Significant alcohol consumption over many years can contribute, and also long-term use of oral contraceptives has been linked in some studies.
Now, here's a really practical tip from the research for listeners. You can sometimes tell where the overgrowth is based on where you feel pain or tenderness.
Yes, this is really helpful. Pay attention to where you feel it when you apply deep pressure to your abdomen.
Okay.
If the pain or tenderness is mainly below your navel in the central area, that typically points towards the small intestine, suggesting SIBO.
And if it's elsewhere?
If the pain or tenderness is more in the iliac fossa, that's basically your flanks, the sides of your lower abdomen, kind of near your hip bones, that's more indicative of an issue in the colon.
And knowing that difference helps guide treatment.
Exactly. It helps determine the right kind of cleansing protocol you might need, whether it's targeting the small intestine or the colon.
So solutions for overgrowth often start with those cleansing protocols. What about prevention or natural ways to keep things in check?
Prevention really centers on reducing that high carbohydrate intake, cutting down the fuel source.
Right.
For natural control, extracts like oregano oil or garlic extract are mentioned as being highly effective. They help manage flora growth, and the research notes they also tend to have antiparasitic and antifungal properties too.
Double duty. And specifically for SIBO in the small intestine, the sources recommend increasing stomach acid levels. Why is acid important here?
Because healthy stomach acid is one of your body's main defenses. It's the natural barrier that helps prevent bacteria from the colon migrating upwards and overgrowing in the small intestine where they don't belong in large numbers.
Ah, so restoring normal acidity helps keep the bacteria down in the colon where they should be?
Exactly. It rebuilds that crucial environmental control.
Okay. And for listeners looking for maybe more cutting-edge options, the research mentioned a peptide, LL37. Sounds technical.
It is a bit more advanced, yeah. LL37 is actually a naturally occurring antimicrobial peptide your body makes.
Okay.
The sources highlight its potential effectiveness not just for digestive inflammation, but also for autoimmune conditions linked to intestinal permeability, leaky gut. It seems to help repair and strengthen that single-cell gut lining we talked about right at the start.
Fascinating. Okay. Moving to our final two causes, bundled together here, let's talk food sensitivities and allergies first.
Right. The obvious culprits people think of are gluten and lactose. And yeah, the general advice is often to try avoiding most cereals and dairy, at least initially.
But you mentioned earlier, not all dairy is the same.
Correct. Many people who react badly to cow's milk dairy find they can actually tolerate goat or sheep milk products much better, as the proteins are different.
Good point.
And maybe more importantly, the sources stress that many intolerances aren't actually permanent. And sometimes the trigger isn't even the main food itself.
What else could be causing the reaction then?
It could be a preservative used in the food, or a colorant, or even contaminant like aflatoxin, which is a mold toxin sometimes found in peanuts.
Wow.
And don't discount emotional reasons either. Stress and emotional state can definitely trigger sensitivities, especially with that strong gut-brain connection via the vagus nerve.
So what are the telltale signs? How do you differentiate a sensitivity or intolerance from a true allergy?
A true allergy usually gives you much more marked symptoms, often immediate, sometimes severe, even dangerous. They're generally impossible to ignore.
Right.
Anaphylaxis.
Hives.
Exactly. A sensitivity or intolerance is typically subtler. Things like cramping after eating, maybe frequent trips to the bathroom that's classic for lactose intolerance, or perhaps increased mucus production, like a constantly runny nose.
Okay. Now, the sources suggested a money-saving way to test for these, rather than expensive blood tests.
Yes. Skip the pricey IgG or IgA blood tests, which can be unreliable for sensitivities. Instead, do a simple elimination trial at home.
How does that work?
If you suspect a particular food or substance, just eliminate it completely from your diet for maybe 3 days up to a week. Keep everything else the same, and just observe closely how you feel. Note any changes in symptoms.
And then reintroduce it.
Carefully. And when you do reintroduce it to test your reaction, make sure you're consuming the pure substance.
Good point. What do you mean?
Well, if you suspect coffee is the issue, drink plain black coffee. Don't test your reaction by having a sugary frappuccino loaded with dairy, sugar, and artificial ingredients. That just confuses the picture. You need to isolate the variable.
Right. Test the coffee, not the toffee shop concoction. Makes sense. And the solution isn't always cutting it out forever.
Not always. Some things, like gluten for people with celiac or strong sensitivity, might need long-term or permanent removal, especially if you notice big improvements in things like joint pain or concentration.
Okay.
But other things, like lactose intolerance, can often be managed. If it's just the lactose sugar you react to, taking a lactase enzyme supplement when you consume dairy can often solve the problem, assuming you don't also react to the dairy proteins.
Okay. Managing versus eliminating. Good distinction.
And finally, we need to make sure we cover the fifth major cause of inflammation: fungi, yeasts, and parasites. This category is frequently missed in standard medical checks.
Right. What makes issues with these different from, say, bacterial overgrowth or food sensitivities? How do they typically show up?
The key differentiating factors, according to the sources, are often the presence of nocturnal symptoms, or a really significant, persistent, almost overwhelming increase in cravings for carbohydrates, especially sugar.
Nocturnal symptoms. Tell us more about that. Why would symptoms flare up at night?
Well, for certain parasites especially, the nighttime is when they tend to be most active, or maybe engaging in parts of their life cycle or migration within the body.
Okay.
This can lead to symptoms like anal itching, which is classic for pinworms, or general restlessness, teeth grinding, or digestive discomfort that only seems to surface when the body is at rest.
And the sugar cravings.
Those intense cravings are often thought to be the pathogens basically demanding fuel. They thrive on simple sugars to maintain their life cycles and potentially suppress your immune system.
Wow. So if you have weird night symptoms plus uncontrollable sugar cravings, this category should be high on your suspect list.
Definitely worth investigating.
And the solution here is pretty direct, according to the sources.
Yes, it involves specific elimination protocols tailored to what's found.
Mm.
The sources are very clear that you need to address these root pathogens directly to reduce the inflammation they're causing.
What does that involve?
For candida or other fungal overgrowths, it usually means a temporary, strict dietary shift away from sugars and refined carbs, combined with specific antifungal herbs or supplements.
Is it for parasites?
That often requires targeted protocols using combinations of antiparasitic herbs or compounds, things like wormwood, black walnut hull, cloves, oregano oil, maybe even pumpkin seeds.
Sounds intense.
It often requires commitment, yes.
Uh-huh.
Identification, usually through comprehensive stool testing, is key. Then you follow a targeted cleanse. You're essentially trying to kill off organisms that can be quite resilient and hidden.
Wow. Okay, we have covered 5 huge interconnected areas then. FODMAPs, enzymes, that flora imbalance, too little or too much, allergies and sensitivities, and finally fungi and parasites. That was a really deep dive into where chronic inflammation often starts.
It really was. And the key takeaway is, if you are experiencing chronic, maybe mysterious symptoms that aren't resolving, you really need to systematically investigate these 5 areas. The goal should never be just chasing the symptom, the constipation, the gas, the joint pain, but finding and addressing the actual root cause that's driving the inflammation, which might have been simmering under the surface for years.
Absolutely. And considering we started this whole conversation talking about the digestive system as our second brain and the home base for 3/4 of our immunity, here's maybe a final thought to leave you with.
Okay.
If your gut health is potentially the single biggest lever you have for controlling systemic inflammation and even your cognitive output, how might optimizing your digestion fundamentally improve those seemingly unrelated physical or mental performance issues that you didn't even realize were connected? Something to think about as you plan your next meal.